Hey, got some vitamin D? In this video, I'm going to share with you why vitamin D is way more important than we originally thought and why both of us should probably take some more. Now don't turn away because all of that starts right now. Howdy! Thanks for learning with me, Dr. Aaron Boster. As a multiple sclerosis neurologist, I routinely recommend that my patients supplement vitamin D. Now that's interesting because when I attended med school, we were taught that vitamin D is a fat-soluble vitamin which helps push calcium into bones. The reality is vitamin D is much more complex and has an impact on multiple different organ systems, including the immune system. In this video, I want to kind of break that down for you and share some of the benefits of vitamin D, not just in the setting of multiple sclerosis, but in many, many different conditions. With that in mind, let's jump in. So let's consider a list of things that vitamin D can help us with. Number one is indeed strong bones. So vitamin D is essential for proper absorption of calcium. And when you have enough vitamin D, you're pushing calcium in the bones, making your bones really strong. This is actually very important in the setting of multiple sclerosis because men and women with MS over the age of 50 have a risk of accelerated bone loss. Their bones can get thin too quickly. And so making sure they have adequate vitamin D is going to help in this area. Number two, vitamin D plays a role in strengthening the immune system. And so this becomes super relevant in the setting of infection risk and in the setting of autoimmune conditions like multiple sclerosis. In MS, low levels of vitamin D pre-puberty increase a given individual's risk to develop the condition. And if you already have MS, low levels of vitamin D drive the disease faster. When you supplement vitamin D and drive the level up above 50 or below 100 in that range, it correlates with a lot of better outcomes like slower disability in MS, less lesions on the brain, less attacks, etc. Super important stuff. But let's keep going. Number three, vitamin D is helpful for your heart. It looks like some studies suggest that vitamin D may be protective as it relates to coronary artery disease. Number four, diabetic prevention. That's right. Vitamin D helps regulate blood sugar levels. And so having vitamin D on board may help protect against early type 2 diabetes. Number five, improved mood. That's right, vitamin D has been shown to have a positive impact on mood and improved depression. Number six, improved athletic performance. There's actually studies that suggest that muscle strength and functioning may be enhanced with vitamin D. Lastly, there is some evidence that vitamin D may be protective against certain types of prostate cancer, colon cancer, breast cancer, things. I like to revisit multiple sclerosis and vitamin D. I shared earlier that low levels of vitamin D increase the risk to develop MS. And if you have MS, low levels of vitamin D can drive the disease faster. I also want to share with you that supplementing vitamin D can help improve outcomes. So there's a blood test that we check often at the Boster Center for MS called a vitamin D 25-OH level. And having a vitamin D above 50 correlates with better outcomes, not just less MRI lesions and less attacks. It looks like the data suggests that vitamin D supplementation may help with other aspects of MS, like cognition, like mood, and ambulation and mobility. If you followed along in the video this far, I hope that I've shared why I think it's a good idea to supplement vitamin D. Now I want to turn our attention to how we get vitamin D. So vitamin D is sometimes referred to as the sunshine vitamin because we get vitamin D when the sun hits our skin. There's a chemical reaction and we produce vitamin D that way, which is pretty slick. In fact, if you went shirtless or in a halter top in full sun for 15 minutes, you would absorb 5,000 international units of D3, which is exactly what I want most patients to take. Now, before we get into different ways of taking vitamin D, I want to make a distinction between D3 and D2. So D3 is the biologically active form of vitamin D, and it's the most easily absorbed in the human body, and it's got the best data for helping with immune function and inflammation as compared to vitamin D2. When I supplement vitamin D, I want people to take D3, not D2. And as I mentioned earlier, when you stand in the sun, you create D3. There's other ways to get vitamin D besides a supplement that you purchase or being in the full sun. This includes egg yolks and really fatty fish. But to be honest, at least for families living in Ohio, you can't eat enough egg yolks and go out in the full sun in the freezing cold adequately to drive your level up. And so very commonly, we're asking patients to take a high quality nutritional supplement. Now, I can't tell you on this video exactly how much you should take because I would need to check your blood level to find out where you are to know what to tell you to take. That stated, most of our patients do very well taking 5,000 international units of D3 once a day. If we find that's inadequate, alternatively, I'll use a 50,000 international unit D3 pill that's taken once a week. So, going out in full sun when you're able to pull it off, choosing fatty fishes and egg yolks are ways of getting D3, and if we need to drive the level higher, we can easily accomplish that with one of two supplements. My name's Aaron Boster, and as always, thank you for learning with me. If you'd like to up your game and up your vitamin D level, consider clicking the link below and picking up some high-quality vitamin D3.